Questions from GA system. First question. The nurse is planning care for several children who were admitted during the shift, and daily weight should be the plan of care for the child who is receiving that. Please select.
TPN.
Total parental nutrition, because when a patient who is receiving total parental nutrition, yes, you have to check daily weight. Okay, why daily weight is necessary? Why checking daily weight is necessary? Yes, please.
TPN is affected.
TPN is?
That one is working or like that in our body.
Basically TPN is given to meet the nutritional requirement of our body. In case of malnutrition, we give TPN. So basically this is given to meet or to increase the weight of a person. Fine. And now tell me, what are other situations where we administer TPN? The situations, indications. Yes, please. Indications for TPN.
Then taking not able to take orally.
Okay, a person who is not able to say person who is not able to take orally. So usually we don't administer TPN, or those who are not able to take orally, we can directly give nasogastric feed, right? Not necessary TPN. TPN is necessary for those patients who whose peristaltic movement or the bowel movement is absent. Okay? Whose peristaltic movement or bowel movement is absent. So that is the situations where you need to administer TPN. Clear? And TPN is usually administered to improve the nutritional status of the person. So daily weight checking is important, and the very important indication to administer TPN is absence of bowel movement or a peristaltic movement, and it is given to improve the immunity. HIV patients we give after gastric surgery, we give, and extreme malnourished patients we administer total parental nutrition. So there are multiple situations where you administer TPN. Okay. Now tell me, what are the components of TPN? What all are the components of TPN?
Carbohydrate, amino acid.
There are three components: protein, carbohydrate, and yes, what else? Protein, carbohydrate, and lipid. Okay, so lipid, which is usually extracted from the egg. Okay, usually egg is extracted from, the fat is extracted from the egg. So before receiving TPN, you can ask egg allergy. All these points you have to write down. All these points are really necessary. So egg allergy has to be assessed before administering TPN. Okay. And who is connected with a real me? Please rename your. If you're not able to rename, please tell your name so I can rename for you. Okay. And what are the complications of TPN? Complication. Yes, please. Complication is when a person who is continuously receiving TPN can develop infection. That is one complication. And circulatory overload. And continuously when the patient is receiving, their blood sugar will be increased. It doesn't mean that the patient is in complication. It's a common thing. Repeat. When the patient is receiving total parenteral nutrition, they will have a complication. One is infection and pulmonary circulatory overload or pulmonary edema, and hyperglycemia is not complication. Continuously when a person who is receiving TPN will have hyperglycemia. So you have to check blood sugar level periodically as well as weight. Weight, when you check, you can identify the improvement of the weight or improvement of the nutritional deficiency, as well as it provides you a clear picture in terms of circulatory overload. Okay, so it can be usually helping to identify circulatory overload, and also it is helping to identify the nutritional improvement. What are the components? It's protein, carbohydrate, and lipid, that is fat. Okay. Moving to another question. You can just read the question and then select the answer.
Yes, ma'am.
Okay. So please go read the question and select the answer. So here, a client with a ileostomy. Where is ileostomy? Ileostomy is situated this at ileum. This is ileostomy. Clear? Ileum on the right or left side?
Right side.
Yeah, it's on the right lower side. Okay. This is the answer. Okay, next question. Read the question. 5-month-old boy has been vomiting green-colored vomits. He has intermittent abdominal pain, during which he draws knee towards his chest, and the patient turns pale and cries forcefully. On observation, stool has jelly-like consistency. Please remember, jelly-like consistency. Abdominal palpation reveals tube-like a mass. No fever, no diarrhea. Hyperactive bowel sounds. nor quadrant. First says abdominal examination reveals pain, where during the assessment, the patient draws his knees towards the chest. So that is indicating patient is having severe pain. Okay, so this is indicating severe pain. So patient is in severe pain. Abdominal examination reveals like a jelly-like consistency, tube-like mass, or it is considered as a sausage-shaped mass. Okay, sausage-shaped mass. No diarrhea, no fever, so it is not related with infection. Hyperactive bowel sound. This is indicating intussusception. So what is this? It is intussusception. So please remember what is intussusception. Intussusception is telescoping of intestinal wall into that. Please look at this. ഒരു portion വേറൊരു portionന്റെ അകത്തേക്ക് കയറിയിരിക്കുക. Okay, so this is considered as a telescope. Okay, so telescoping of intestinal wall into that, and it is causing obstruction. So towards the distal portion, the amount of stool which is not moving, so it entire thing accumulates at a proximal part. So intestinal obstruction will happen. So how do we manage this? We manage this with giving normal saline enema. Okay, so there are 4 options given: manual manipulation, surgical resection, normal saline enema, and laparoscopy. Initial management is always normal saline enema. Clear? So remember, what all are the signs of intussusception? Those who don't know, you can write down. Intussusception will have current jelly-like consistency or red mucus-tinged tube and sausage-shaped mass, hyperactive bowel movement, severe pain, abdominal cramps. There may be chances to get a vomiting, and the vomiting will have the color green colored. Why it is green colored? Because the intestinal content moves up. So automatically the content from duodenum will come back to the stomach and it will come out. The duodenal content is always some greenish in color with the presence of bile. And in this situation, there may be chances to get fecal content emesis also. Because as a result of intestinal obstruction, sometime the fecal content vomitus will also come out. Okay, intestinal obstruction കാരണം നമുക്ക് എന്ത് വരാം? Fecal content emetus അല്ലെങ്കിൽ emesis വരാം. Okay. In case of severe intestinal obstruction and fecal content emesis, how do we manage? Yes, please. Yes, anyone please? If you notice, fecal content emesis, അത് vomit ചെയ്യുമ്പോൾ fecal content പുറത്തേക്ക് വന്നാൽ എങ്ങനെ manage ചെയ്യും? If the patient has fecal content emesis, what you need to do, you should not allow the patient to vomit. Okay, so for that you can insert an nasogastric tube and then decompress the stomach. Okay, stomach content decompress here. So you can insert a nasogastric tube and then let the entire content come out. Clear? So how do we manage this? I want everyone to learn intussusception. So how do we manage intussusception? First, we give normal saline enema and gastric decompression. Why? To avoid aspiration and to avoid respiratory infection. Okay. And keep NPO. When we keep NPO, definitely IV fluids, electrolyte balance, and closely observe the signs in symptomatic management. Clear? What are the signs of intussusception? Yes, please.
Jelly-like consistency,
Jelly-like
sausage-sized mass,
Yes.
severe pain,
Yes.
Abdominal pain.
cream color
Yes.
mucosa, and fecal content vomitus.
vomiting.
Okay, very good. Okay, this is another question. Woman patient with a body mass index of 35 is admitted to what? Which of the following nursing diagnosis related to imbalance the most appropriate? So what is BMI here? It is 35. So what is the normal BMI?
18 to 24.
How much? Can you repeat it?
18 to 24.
23rd. Okay. Any other answer? It is 18 to 24.5. Okay. So 35 is increased or reduced? It is increased. So it is indicating obesity. Okay. BMI 35 is indicating obesity. Now select the answer.
More than body requirement.
Yes. It is nutritional, not deficiency. It is extra nutrition, more than body requirement. So restricting diet that is required. Okay. So the answer is C. Please remember BMI less than 18.5 is indicating malnourished. 18.5 to 24.5 is considered as normal. Greater than 24.5 is abnormal. I repeat, less than 18.5 malnourished. 18.5 to 24.5 is normal. Greater than 24.5 or 25 is considered as abnormal. Clear? Next. The nurse is caring for a patient receiving total parenteral nutrition. The patient reports sudden onset of feeling shortness of breath and anxious. The nurse hears crackling sound in bilateral lower lobe of the lung and the patient's oxygen saturation is 90. What the nurse must do immediately. So first of all, what is this indicating?
Circulatory overload.
Yeah, it is indicating circulatory overload. So what are the complications that we learned while receiving TPN?
Circulatory overload, pulmonary edema,
Pulmonary edema, circulatory overload, and then one more,
high
infection. And hyperglycemia, it's common thing. Okay, so this is indicating circulatory overload or a pulmonary edema. So you have to immediately work on that. Yes, so what can be the answer? Turn off TPN, notify the physician, assess the patient's capillary glucose level, attempt to suction the patient's airway. Okay, fine. So, turning off the TPN. Yeah, turning off the TPN is okay, no problem. But remember one point. Sudden turning off of TPN can cause hypoglycemia. Remember, sudden turning off TPN causes hypoglycemia. Usually, when a patient is receiving TPN, there may be chances to get a hyperglycemia. But when you stop that, it causes hypoglycemia. Okay. So usually when patient develops circulatory overload, what we do is usually we reduce the flow rate and almost we stop. Without stopping, the symptoms are not going to improve. So definitely stopping is important. But meanwhile, we start a DNS patency drip. Usually it is started. Why it is necessary? Because sometime when patient develops hypoglycemia, don't be panic. You can just increase the DNS drip. Okay. So sudden stopping of TPN can cause hypoglycemia. So TPN has to be stopped to manage circulatory overload, but patency DNS drip is necessary. Okay, but that is not associated, which is not available in this option, so you can take A. Okay, but actually, when you stop, there should be a patency drip of DNS. Why? It is necessary. It is really necessary to prevent hypoglycemia. So I want all of you to learn when patient is receiving TPN, there will be chances to get a hyperglycemia. When you stop it, when you suddenly stop the fluid or suddenly stop the TPN, it can cause hypoglycemia. Okay.